All right, let's get right into it. The moment you call 911 for a suspected stroke, you kick off this incredible high-stakes race against time. But have you ever wondered what's actually happening in those crucial minutes, between that phone call and the ambulance rolling up to the hospital? Well, today we're going to pull back the curtain on the pre-hospital stroke protocol. It's the detailed playbook that paramedics follow to save brain tissue, literally 1 second at a time.
A stroke isn't just like an attack on the brain, it is a brain attack. And when that clock starts ticking, you might picture this chaotic scramble. But actually, it's the total opposite. The second a potential stroke is reported, a superstructured, meticulously planned emergency response just kicks right into gear. So what's the very first domino to fall?
It all starts right here. I mean, think about it. You can have the most advanced medical plan in the world, but it's completely useless if no one ever hits the go button. That first, most critical step, it's not taken by a paramedic. It's taken by the person who sees something is wrong and makes the call. That is the first and maybe the most important link in the entire chain of survival.
Paramedics, and really all of us, are trained to look for these 3 big signs. First, weakness. This is often that classic one-sided facial droop or an arm that just suddenly won't lift up. Then there's difficulty with speech. This could be slurred words or something even weirder, like using totally jumbled or nonsensical language. And finally, an altered mental status. Just sudden confusion, being disoriented, or even completely unresponsive.
Okay, so the 911 call is in, EMS is on scene, and they spot one or more of those signs. Right away, their job shifts from just observing to actually investigating. They launch immediately into a methodical assessment to figure out exactly what is going on.
And this is definitely not guesswork. It's a very specific 3-step process. First, they gather history from the patient or family. Do they have high blood pressure, diabetes, a history of stroke? Are they on any blood thinners? Second, they confirm the signs and symptoms for themselves. But third, and this part is absolutely crucial, they have to start ruling out other things that can look exactly like a stroke. And that leads to this huge question. In the medical world, this is called making a differential diagnosis. Basically, the paramedics become detectives on the spot. Their job isn't just to confirm a stroke, but to prove it isn't something else entirely.
Now, this is where the detective work gets pretty tricky, because a few other conditions are perfect stroke impersonators. A recent head injury, even being intoxicated from alcohol or drugs, they can cause similar symptoms. But the number one, most common, and critical stroke mimic they have to rule out right away is hypoglycemia.
And this is just a beautiful example of the protocol's elegance. One of the very first things a paramedic will do is a quick finger-stick blood glucose test, or an FSBG. Why? Because when your blood sugar gets dangerously low, it starves the brain of energy and can perfectly replicate the symptoms of a massive stroke. It's a simple, fast test that can completely change everything right there on the scene.
Okay, so they've done their initial check, they've ruled out the common mimics. Now we get to what is arguably the single most important piece of information in this entire pre-hospital phase. It's the one thing that dictates every single decision that comes next.
It's called the last known well time. And notice, it's not when did the symptoms start. It is the exact time that person was last seen being their completely normal self. So if someone goes to bed totally fine and then wakes up with symptoms, their last known well time is whenever they went to bed, maybe 8 hours earlier. This one piece of data is the key that unlocks the entire next phase of the protocol.
You say that last known well time isn't just some random note for the chart. It forces the paramedics to make probably the most critical decision they'll make out in the field. Which hospital are we driving to? Because, and this is important, not all stroke centers are created equal. And this is the number that drives that whole decision. Less than 4 hours. So why 4 hours? Because with a stroke, millions of brain cells are dying every single minute. This window is the make or break time frame where powerful clot-busting drugs are the most effective and the safest to use. It creates this major fork in the road, and it sends the ambulance down one of 2 very different paths.
And here's that fork in the road. So on the left, if the last known well is inside that 4-hour window, some really advanced treatments are still on the table. The paramedics will do something called a van screen, and if it's positive, they might actually bypass a closer hospital to get to a more advanced, comprehensive stroke center. But on the right side, if it's been more than 4 hours, the whole strategy changes. The number one priority just becomes getting to the nearest appropriate stroke center for stabilization.
So what is this VAN screen thing? Well, VAN stands for vision, aphasia, and neglect. And it's a really quick test to check for signs of what's called a large vessel occlusion, or an LVO. The easiest way to think of it is like a major plumbing blockage in one of the brain's biggest pipes. These are the most severe strokes, and they often need a special procedure to physically pull that clot out, a procedure that's only available at those higher-level comprehensive stroke centers.
All right, the decision's been made, the ambulance is racing to the right hospital. But the work is not even close to being over. Everything they do now while they're driving is about saving time once they get there. It's all about making sure the handover to the hospital team is absolutely seamless.
And this is basically their in-transit checklist. Every single one of these items shaves precious minutes off the clock at the ER. They're getting IV access ready for medications. They're getting the patient's weight, because those clot-busting drugs are dosed by weight. They're getting contact info. And then they make the single most important phone call of the entire trip.
They call in a stroke alert. This call is like sending up a bat signal to the emergency department. It mobilizes the entire stroke team, the neurologists, the CT techs, the nurses. It means they are literally assembled and waiting at the door when that ambulance pulls in. The hospital's clock didn't start when the patient arrived. It started the moment the paramedics called. It is just a beautifully coordinated handoff.
So we've just walked through this incredible step-by-step plan that paramedics follow to give a stroke patient the absolute best chance. It's a system designed to save the brain. But that entire life-saving cascade, it doesn't start with a paramedic. It starts with a bystander, a family member, a friend, someone who recognizes the signs and makes the call. The plan is always ready to go. The real question is, would you know when to activate it?